It's a lot of calories for the body to make milk.
Breast milk. It's like 500 calories a day.
Yeah.
I can't even work out that much calories. Hi, my name is Lene. I'm a certified breastfeeding specialist.
Hi, I'm Angela. I'm a clinical nurse specialist and an IBCLC.
And we're here to answer your most frequently asked questions about breastfeeding.
Yes, the questions you're dying to know.
Let's get started. All right, let's pick our first question.
Okay. Are breastfeeding benefits exaggerated?
Why is it worth it to breastfeed? What is so valuable about breast milk?
Sometimes breastfeeding's hard, so you gotta know that it's worth getting through it. We're not bashing any moms that made any other choices in their lives because you just do the best with what you have, or sometimes moms even have problems producing milk. So we don't wanna make anybody feel bad. What we're really looking at is this really exaggerated or not?
Yeah.
We want you to make an informed choice if this is something that you wanna do.
I honestly think it's amazing because there's living live cells, like stem cells and white blood cells and all these like immune building components. You look under a microscope and it's moving, it's alive, and
it's talking.
It's talking.
It's communicating with the mother's system too. So one of the things about like pumping that's really interesting is, yes, you could exclusively pump, but you do lose some of the components of milk by doing that. Just like taking them out, a little bit of the milk gets changed. But it's also this complete system, right? We call it the mother milk baby triad for a reason, because actually the baby's saliva is going into the breast and telling the mother about its environment. So it's saying, I just got exposed to the flu today, so could you make some antibodies for me? And then the milk goes, oh yeah, okay, I got some of those antibodies and I'm gonna bring them to the baby. That is like amazing. I often look at human milk more as immunity than nutrition. Drug companies are really interested in human milk because they're like, whoa, that stuff's amazing. How do we get some of that? And you have it for free. It's living right there in your body. I would say, is it exaggerated? No.
I would say it's not exaggerated enough.
I don't even know all the great things about it yet.
It's amazing.
It's amazing. It's totally worth it. And if you think about it, millions and millions and millions of dollars are being spent to replicate the one thing that you have, your superfood that you can give your baby. Okay, ready for another question?
Next one. Is breastfeeding still beneficial after 1 year?
This is a good question because the AAP just changed their guidance, right? That you should be breastfeeding for a full 2 years.
2 years.
So important.
It's so important, and I love that just helps solidify that it's still beneficial, and not just for baby. It's beneficial for mom too. Breastfeeding helps decrease risk of ovarian cancer, breast cancer, diabetes, and heart disease. It's amazing because, as we mentioned before, breast milk will change in composition to your baby's needs. So even when they get older, even when you introduce complementary foods after 6 months, it still benefits your little one.
But remember, one of the biggest benefits for breast milk is immunity. So it's still programming the baby's immunity, fighting off illness, fighting off disease. One thing that's super fascinating, Lene, is if you breastfeed a baby 6 months exclusively, at 5 years, they will have much less chance of diarrhea. And diarrhea actually is something that kills a lot of young children across the world. So that benefit, the programming of the gut microbiota, all of that is extended over a lifetime. It's really amazing.
A lot of people think if you breastfeed beyond 1 year, it's spoiling your child, but it's not. It's actually because you have that close contact with them. It makes them more secure, and then they become more independent later in life. So you're not spoiling.
Another really big thing is if you think about when you're breastfeeding an infant, right? You're breastfeeding 8 to 10 times a day. That's a lot. When you're breastfeeding a 1-year-old, you are not breastfeeding 8 to 10 times a day, right? You're breastfeeding at naps or at bedtime. So it's a time of like wind down, security with mom. And you know, I have teenage kids. They grow up before you know it. They're up and out of the house. So taking that time, spending that quality time with your kids, giving them that ultimate nutrition and that comfort is super important for babies.
It is. So yes, breastfeed as long as you want.
Okay, let's do the next question.
All right. Will breastfeeding hurt?
This is a really good question. You know, when I was pregnant with my first baby, my stepmom said to me, oh, I had cracked and bloody nipples when I was breastfeeding. And I was like, oh my God, that sounds terrible. Why would anybody want to do that?
Breastfeeding shouldn't hurt, that means something's wrong. If there's pain, your body is super smart and it associates pain as like something's wrong. That means probably the baby's not getting milk. So check the latch. There's so many things, your body, just listen to it. So if there's pain, check the latch. Ask a lactation consultant for advice.
If you have cracked or bloody nipples, go straight to the lactation consultant because she's gonna help you. There's no reason that anybody should be putting up with that kind of pain. The other thing is, if you have cracked or bloody nipples, that means you're primed for an infection. Anything can happen that can travel then into your breast, and so we want to resolve that right away.
We both know that moms get so excited, the baby's latched, and they're like, I'm gonna put up with the pain if this is normal. It's like, it's not normal.
It's not normal. And that's why lactation consultants are available, because they can really help you. Sometimes it's positioning changes. Sometimes there's even things with the baby's anatomy that could be causing that. So you need to go to a professional. I would definitely say an international board certified lactation consultant, because they're clinically trained to check through all those clinical issues. It's great if you have a lactation support person, but if you can't get answers, really need to go to an IBCLC.
Yeah, they'll be able to see if there's a tongue tie, lip tie, which can cause that bad latch. But overall, breastfeeding shouldn't hurt.
Shouldn't hurt.
All right, next question.
All right, what do we got?
Are breastfed babies more clingy?
This is a good one too.
You know what? I just got this question. My best friend just gave birth like a week and a half ago. When I came over, she's like, I don't want to spoil my baby too much by holding her or breastfeeding her too much. And I was like, you can't spoil a baby. There's no such thing.
Yeah, you know, you can't really spoil a baby. Like, they don't come out really manipulative.
No,
right?
they don't. They don't. And that's exactly that. They are now out of your body, and all they've ever known was inside your body. They know your heartbeat. They know you're breathing.
When they're skin to skin, you're also keeping them warm, right?
Yes.
So the body knows there's a baby there and is putting more blood in your chest than is even in your brain. That's how important.
Oh, I have goosebumps.
I know. That's how well, because you're not being warmed up by a mom. That's how important the body thinks it is. So when your baby's skin to skin, your baby's like, oh, this is my mommy. Okay, I know where I am. I'm safe. I'm doing good. The baby's smart enough to do what I call the protest cry, which is anytime away from mommy, I'm gonna cry because I want mom to know that I'm over here. Somebody take care of me. Babies are actually really born with really good survival instincts, and that's what we want for them.
Super instinctual.
They don't know that the crib is a safe place.
They don't.
Right?
They just know that their mom is. And so there's no such thing as a clingy baby. They're born to be clingy. You are their safe space. Your partner doing skin to skin is also their safe space.
Skin to skin. And you know what babies love is the partner's voice. So it could be dad, could be anyone, but the person the baby knows really well because has been hearing this person's voice the whole time. And I've tried this out on thousands of parents, honestly, because a lot of times the partner, dad, whatever, in the delivery room really has nothing to do.
Feels left out. Like, what can I do? The baby wants mommy.
Mom's all about, the nurses are all around the mom. So what I always say is come over, talk to the baby. And the baby will really stop crying because they're like, oh.
There's videos of this. If you look this up, there's videos of dads talking. They know the voices.
And that's one way dads can be really comforting. Or it could be grandma or whoever has been around the mom a lot, the support person, because they absolutely know that voice and it helps them feel safe and secure. So I agree, no clingy babies. And what research really tells us is that babies that have been breastfed, have been held a lot, have been held skin to skin or in a carrier, they actually have less separation anxiety when they get older.
Because they have this foundation of feeling safe and secure, and so they can develop more in that safe mindset that then they become more independent, more secure in themselves, because that's what was built, that was the foundation.
Yeah, one other thing I asked you that weekend was, where was the baby's crib? Right, and why did we ask that?
Because your baby wants to be close to mom, so it's good to have that crib, that bassinet right next to the bed, right in within reach. You can put your hand on the baby, soothe them.
That's a good trick because the baby really responds to direct pressure, right? So when they're on skin to skin, they're like, oh, I'm safe here.
Yeah.
So
that's why adults love weighted blankets.
That's right, right? But we can't put a weighted blanket on a baby.
No, we
can't.
But
we can put our hand on them. So that'll kind of calm the baby enough for when the baby finally falls asleep. But another thing is We don't want babies in a separate room in a crib because that's actually one of the risk factors for sudden infant death syndrome, because babies get in too deep of a sleep when they're separate and a room is too quiet. They actually do better when they're in the room when dad's snoring and there's noises, the dog's walking around, whatever's going on. That actually creates a little bit of a stimulation that keeps the baby a little bit awake and alert. So we don't want babies in super deep sleep because that's how they get in trouble.
Yeah.
All right, are we ready for another question,
Yes,
Lene?
we are ready. When will my breast milk supply regulate?
Ooh, good question.
Let's start off in the first 2 weeks. So
Okay.
after 3 to 5 days, your breast milk has matured, and that's when your breasts go into programming mode. It is still being regulated by your hormones, and it's figuring stuff out, but setting you up from like 3, 6, 9 months from now. So let's talk about then after the 2 weeks, what happens there? That's supply and demand, from hormonal to supply and demand.
Yep. So you have to be taking the milk out in
Yes.
order to make more milk. But the tricky thing here is that also things happen with babies, right? Babies go through growth spurts and sometimes they're demanding more milk, and that's normal, right? So I think to think that it's going to be perfectly regulated is a little bit harder, but after about 2 to 4 weeks, you kind of start to get in a groove with the baby and it seems more natural, more normal. You don't have that like super engorged feeling anymore.
A lot
but
of
that's
moms
normal.
think that if they don't feel that full, then they don't have enough milk, and that's not true.
That's not true. It's just the body's getting used to it now. It doesn't have
Figuring
to
it
have
out.
the swelling and all the other things. And really, the body does not want to produce too much milk because, again, we're inherently lazy and we don't want to spend any time doing anything.
It's a lot of calories.
It's a lot of calories for the body to make milk.
Breast milk. It's like 500 calories a day. I
Yeah.
can't even work out that much calories.
Right.
Breastfeeding is amazing, and it takes a lot of energy.
It does. And so it's really energy depleting for the body. So the body is always trying to figure out, how can I skate by without making too much so I'm not wasting, right? Or overproducing. So that's why the supply and demand part is really important. So if you start to feel like your supply is going down, you need to demand more milk. Adding a pumping session or another feeding session will kind of tell the body, hey, we need more milk here. You need to pick up the production. Consequently, too, if you leave milk in the breast and it starts to get full, there's programming that happens that's called the fill program. So it basically starts popping the milk making cells and says, we're not going to need those anymore because this baby doesn't need that much milk.
Yeah.
You don't want to get super tight. You need to be kind of removing milk on a frequent basis throughout the day. And those cells never come back till the next baby. If you are letting yourself get really full during the day and not pumping, like if you're away at work or something,
Your body's learning. It's like,
Your
there's no
body's-
demand. I don't need to
do
provide
this.
the supply.
yeah, so that's one of the ways that it'll start to downregulate. Okay.
All right, next question.
All right. How often should I breastfeed my newborn?
Ah.
This is a good question.
This is a good one. On average, we say 8 to 12 times a day, but when it comes to a newborn, it's really on demand. It really is. That's your time to bond with your baby. Your baby's learning just as much as you are about breastfeeding, so there's not really an exact science, right?
Yeah, so we say 8 to 10 times in a day because we're saying in a 24-hour period, that's how often a baby should be eating. But sometimes babies are doing things like cluster feeding.
Yes.
So the baby might eat like every hour for a couple hours, but this is good. This is the best for you. When your baby starts cluster feeding, you're like, this is gonna be great. Because what that means is the baby's gonna do a long sleep after that. So it's real normal for babies to kind of tank themselves up like that. And you know now you're gonna at least get that. If you get 4 hours of sleep, like one full REM cycle, you like feel like a new person, right? So if you can get that long sleep, you want it. So when babies start doing that, that's a really good sign. And then sometimes babies eat for a long time. So we don't want people to be like looking at the clock. So people will say to me, how long should the baby eat? We used to say like 10 to 15 minutes, but we really don't want people doing that. Say a baby's eating for 45 minutes at a time. That would be to me like a sign that maybe it's feeding too long. So a really great trick is called breast compressions. Sometimes babies get to the breast and they're like, oh, mommy, like this is the greatest place in the world,
So
and I
happy,
never want to leave
so
you. So
content.
I'm going to trick you and pretend that I'm feeding. So I'm right here next to you the whole time. So I might like suck and then take a little break. And then if you move at all, I'll be like, oh, I'm still eating. What are you doing?
So yeah, you want to then kind of wake them up.
Yes.
Change it up. Be like,
And the
hey,
best way to
you're
do-
here for a reason.
That's right. right. We got work to do, right? So the breast thing to do is breast thing to do.
The breast thing
The
to
breast
do.
thing to do is give your breast like a little squeeze of milk. And so that helps too because there's milk way back here, right?
Yes, all the
so
way
we're
by the
helping,
armpit.
yeah, sometimes all the way up there. We're helping the milk come down. We're giving the baby a little squirt of milk. That changes the nipple in the baby's mouth. So the baby's like, oh, okay. And we'll start the feeding again. That's the best way to kind of tank up a baby in the feeding. Hey, remember when you called me last weekend about your friend that was having a problem? And that's what we were talking about, right?
Get that baby excited again by getting that milk there. What's also really important to note, a baby feeding on day 1 is going to feed probably very differently on day 2 and 3. So maybe day 1, they're feeding every 2 to 3 hours.
They're probably really sleepy on the first day.
They're super
They
sleepy.
look like the best babies in the world. On day 2, they wake up. What have I been doing with my whole life? I'm starving. And now they're like at the breast all the time. And you're like, what is going on? I used to have this angel baby. And now the baby's like, wants to be at the breast all the time, doing lots of cluster feeding.
Yes.
So remember, cluster feeding's good, right?
Cluster feeding.
Because cluster feeding is demanding that the body kick it up and start making milk.
So we have on day 1, super sleepy baby. Day 2,
Angel baby.
the baby wakes up and does cluster feeding, and it's telling that body like, make the milk, make more milk. And then day 3.
Oh, the night of day 3.
Day 3.
It's
3
rough.
a.m.
You guys need to know this, okay? Because this is when most moms give up. And this is when most moms, if you got sent home with some formula, will pull the formula out. This is when I keep my phone on with my friends. When they're having babies, I leave the phone on at 3 in the morning. Now, they never call me, but they'll always text me. So I'll always respond because this is the hardest day of breastfeeding.
So the big
big transition. So the body's like never done this before, right? It's got to come up with some milk. It's learning a new skill. And this baby's been really demanding. And at night and at 3 o'clock in the morning, it's the worst. Mostly because you're super tired, right? You had
exhausted.
a baby. Nobody's getting any sleep. You had a whole bunch of visitors. So every time the baby was sleeping, you didn't really sleep. So now you're just exhausted. And this baby is up all night wanting to feed. The good news is that is actually going to be what makes the body like kick it into gear. So usually that morning or that afternoon, you'll have that copious milk supply come in, or it could be just starting to transition at night and now you're engorged and it's really hard, and then it's hard to get the baby on. A couple things we talked about engorgement in another topic, but really doing the breast massage,
compressions,
trying to get that milk to come out. And then once you get that copious milk supply, it gets a lot better, right? The babies get more satisfied at feedings. They'll go for longer periods of time, but still will do a little bit of that cluster feeding. And then you're going to be like, yes, I'm going to get it now.
Right. So it may not be perfect to the clock. It will change. They're figuring it out as much as you are too.
Yeah, just meet your baby where he is. Whatever he wants to do, just feed him on demand. This isn't going to last forever. After a couple of weeks, breastfeeding gets really easy. In the beginning, it just feels like, I think because it changes every day, right? And you just think, just as I got used to this and I had it kind of figured out, now you throw me another curveball.
It changes.
Right? The baby's always throwing curveballs, right?
And that's why we want to feed a newborn on demand. Why don't you pick a question?
Okay. Let's see what we got. How can I prevent or treat sore nipples while breastfeeding? This is a popular question.
Well, are the sore nipples caused from a bad latch? Or is this just the initial discomfort because your nipples aren't used to it, right?
So the number way to prevent sore nipples is to get a good latch. And sore nipples really come from babies that are on the end of the nipple. And if you think about the inside of your mouth, anything that's hard that's on the end of your nipple is going to hurt and can even cause cracks or bruising. So the trick to that is to get the baby deep in the mouth, and that means your nipple will be in the soft part of the baby's mouth. So if you can feel in the top of your mouth,
that
you can feel
how
far back the baby has to get. Now the way to do this is something really goofy that nobody would ever think. In fact, it's so counterintuitive, that's why people don't do it. So when you see a baby's mouth and you have a nipple, you just want to put it right in there, right? That's like your first thought. But what you do is something that you would never think, and you actually point the nipple to the baby's nose. nose. Why do you do
Nipple
that,
to
Lene?
nose alignment. That way, and then their chin's resting and they open wide and they take in that nipple.
Yeah, and they kind of like start from the bottom then and go around the nipple,
Like
and
Pac-Man.
then like Pac-Man. Yeah. And then the nipple is really far back. That's the way. So here's the thing about breastfeeding. When the baby first draws the nipple out, there's a little discomfort there. So like maybe the first 10 seconds, but if it hurts after that or feels pinchy or anything like that, you know the baby's not on good. So you need to get the baby off. Now, you don't want to pull the baby off because the baby's gonna pull the nipple right with you. So you want to break the suction, put your like little pinky finger in the baby's mouth just to break the suction, and then start over. You know what's another really good tip is something I call a little to the middle. So it's true. So a lot of times we'll like want to put the baby on like straight on the breast, but if you move the baby a little to the middle, tuck the baby's like butt right in here on your elbow, then the baby's kind of coming from this angle to get on. But when we go straight on like this, it also smushes the breast into the baby's nose, and then the baby has a hard time breathing from there. So just a little to the middle will help.
A little to the middle.